Do you know that I would tell them that they're diverting from the real issues of the Pelosi bill, which is government takeover of health care, exploding the deficits because it's not paid for and it's got high taxes in it. And they're not doing anything to reduce inflation. And I think that this is what a president or a speaker of the House has to do when they have a miserably poor health care bill that's not being received by the people. So what they try to do is divert attention, and they've done a very good job of diverting attention, and they're intellectually dishonest when they say it, because all of their proposals dealing with end of life are connecting bills with ways of saving money and takeover of national health care. And you see what goes on in other countries. And I don't want that to happen in the United States, that we treat life at age 85 different than we do life at 35.
Okay, but the president would say he doesn't want that either. And your critics have pointed to your vote in favor of this Medicare bill back in 2003 that included what they say is a similar provision that would pay for end-of-life consultations between a patient and her doctor. Not mandatory, but if the patient wants it, they'll pay for it. And that you supported that, and now to come out and suggest that a similar plan by the House Democrats is pulling the plug on grandma is really unfair of you. How do you respond to the charge?
Well, I'm glad to respond to that, because if you read the committee report from 2003, you will find out that we were talking just in the very narrow area of hospice care, and managing pain was a very important thing in that as well. Nothing to do with saving money. And when you get into what their goals are in the House bill, it's to save money. And not only that, but it costs $8 billion. And we never had anything like that in the bill in 2003.
And your concern is the plan to save money and cut costs, coupled with these end-of-life consultations, raises questions, I guess.
And coupled with government takeover of health care. And that's a really end product of the House bill that has a government-run plan. And the Lewin think tank in Washington says that 120 million people are going to crowd out into that plan, and when they crowd out, premiums go up, and pretty soon everybody else leaves, and pretty soon you have the government running our health care, and the American people don't want that.
Senator Grassley, before I let you go, I got to ask you about Ken Conrad's comments on Fox News Sunday. Do you agree with him? He's part of your gang of six in the Senate working on this bill, that there is no way a public option or a government-run option is going to pass in the Senate?
Yes, I agree with him, except for we're not a gang of six. I don't like gangs. I'm a group of six, and we're trying to get a bipartisan cooperation. And one of those things is not to have a government-run health plan, because it leads to nationalization, and Ken Conrad is absolutely right. That couldn't get through the House of Representatives.
Group member, not gang member, Senator Chuck Grassley.